live. We're live.
Well, we're going to have some fun here in a few minutes here. We'll wait for just a few minutes for people to get on. Coming to you live from Mesa, Arizona, home of the rattlesnake and the cacti, the saguaro cactus.
We already got 52 on here.
Yeah, awesome.
67, we're jumping up.
Gonna be fun.
Cool.
Hopefully everybody out there in the Insta land is doing well.
Ormco Russia says hello, Dr. Frost.
Hello. Yana, I want to thank you for putting this together. Very exciting. And can't wait to have a few minutes to share with you. So, again, we're going to wait for just a few minutes until we get, I think we're almost 9 o'clock Arizona time. And we'll get started here. Can't wait to share with everybody a couple of thoughts I have and share a new case. Everybody likes to see a new case, right?
Yeah.
So we'll share a new case that I just finished, or that Dr. Nichols and I just finished. So give it another couple minutes here for people to get on, and then we'll get started.
Cool.
Yeah. Awesome. That looks good.
Yeah. Do you want to see?
Yeah.
Yeah.
You come around for a second.
Yeah.
See what we got here.
Got quite a few. People are already saying hi, waving.
Great.
Got 176 people on at the moment.
Fantastic.
Wow, numbers are jumping.
Okay.
Love the support.
Yeah. I miss Russia. Now I gotta say, before we get started here, I've been to Moscow twice, and I've not been to St. Petersburg. So maybe next year, let's put this into Ormco's ear. Hopefully they're listening, that I get to come to St. Petersburg, because I hear that that's a beautiful, beautiful city. And in fact, the people that have been there that I know say that St. Petersburg is probably one of the most beautiful countries in the world.
I've heard that
So
too.
one of the most beautiful cities in the world.
Mm-hmm.
Yeah. So, okay. It is 9 o'clock. How many do we have going on here, Brad?
244. Numbers
Pretty
keep
awesome.
jumping. Yep.
We've got 244. We're going to give it another 30 seconds. Maybe while we're waiting just another 30 seconds or so to get started here, I'll just my son Brad is over here. Here he is. This is my technical support.
How we doing?
Many of you have met Brad before, and so this is coming to you live from Frost Orthodontics, and we are in Mesa, Arizona, United States, in the Southwest, and we're at the practice right now doing this live Instagram. I want to introduce Dr. Nichols, who is my partner. And look at this. Let's see the gun show. There it is.
Russia. Good to be with you. You're going to have a great lecture by Dr. Frost. It's great to be with you this morning, and we love y'all.
Yeah.
Awesome.
I mean, I try to do the same thing, but these don't quite compare, but it's not about that.
They're pretty dang good, though. Yours are pretty good.
Hey, I think that we'll get started here. We're 9:01. How many people we have on here, Brad?
307.
307 people on live Instagram. I think it's fantastic. Hey, so fun to have you here today. I'm excited to share just a short hour with you. And, I wanted to, before I get too far into this, I just wanted to share with you that, the world is in turmoil. And many of us are experiencing some craziness. It's a time that I've never seen in my short amount of time on this earth. And one thing I wanted to share with you is that we feel your pain and all of our pain, and together, I think that this, unfortunately, this COVID virus is uniting us as a world to fight against something and have common ground in an area where we're all wanting to be healthy. And I just want you to know we're thinking about you. I wanted to give you a couple of quick comments I think is so important. I hope you're staying safe. I shared this with my team, and I think that we as orthodontists have a ability to share positivity, to be a leader in our practices and a leader in our communities. And I wanted to give you a couple, maybe 3 or 4 little suggestions during this really difficult time to help you be positive and help you with your practices. Ours is shut down right now. We're almost the whole United States is shut down, and I'm sure many of you are as well. But I want to give you 4 little tips during this time. Excuse me, I'm not crying, but I want to give you a tip. I think that this is now more than ever before, we need to have a positive, abundant mindset. We need to be able to be positive to those that are around us and really help our friends, those that are struggling, be positive. You know, we could choose to be negative or we could choose to be positive. It's up to us. And so I'd encourage you to be positive. Number two, I want you to understand that you can't control what's going on in the world today with this COVID virus and everything that's happening. Don't let this virus steal your joy. And what I mean by that is that you have the ability to choose, you have the ability to have a positive mindset, even though you can't control the circumstances. That's what we're doing in our practice. I'd encourage you to share that with your families and with your practices. Number three, relax a little bit. People are doing crazy things right now in the world. I see people at the grocery stores in the United States and they have plastic bags over their heads or they're wearing weird suits. Just everybody relax. It's going to be okay. We're going to be safe. The fourth thing I'd really like to share with you is that this is a time where you can work on your practice and work on your skills. And this is a time where you can really get into your practice and double down on what's important. If you're not working right now because of the virus, then work on your practice, work on your skills. And that's why I've decided to do this free seminar for you so that we can work on our skills. So with that, I want to say hello to Dr. Pazzi and Dr. Zernoff who have been to my practice. Hello, my friends. Hope you're doing well. I would invite all the rest of you to come. Please don't come at once, but would love to see you sometime. So with that, let's get started. What we're going to do is I want to talk to you about mastering passive self-ligation. This is for all of you in Russia. There's probably going to be some others in the United States that are here. My name is Dr. Stuart Frost. I want to thank Ormco Russia for asking me to do this. I have a fondness in my heart for those that are really making a difference in Russia. Ormco, I just love what they're doing. They're providing value for you, and I want to provide some value as well today. So with that, please follow me at Dr. Stuart Frost on Instagram. I share cases and would love for you to be a part of that. I'm in Mesa, Arizona. I was a general dentist for 5 years. I did a 1-year fellowship in TMJ. I spent my orthodontics at Eastman Dental Center, and I've been 20 years in practice and 20 years with Ormco. And I've seen a lot of things come and go, and I want to share with you this little slide. I've been 20 years strong with the Damon system. I met Dr. Dwight Damon here in 1997, right after the Damon SL bracket came out. I've been involved in every bracket since then. In fact, this is where we're at right now. What you might have heard is that there is another bracket that's making its way that we're doing clinical trials on. I'm not going to tell you much more about that. We're finishing cases in it already, but the one thing I want to just point out is that this is innovation. That's what Ormco is all about. They don't rest on what the bracket was back in 1996 or in 2004, but they're actually changing technology and making things better all the time. So with that, I'm going to get right into this. I want to share with you what I feel like is the pillars of the Damon system and what those pillars really are. And number one is that, and I heard this from Dwight Damon in 1997, and he said, for the first time in history of orthodontics, we're truly treatment planning our cases to the face. And he started to explain that, and I didn't know what he meant in 1997, but he really said we're looking at the upper lip, we're looking at the face, designing our cases around that instead of treatment planning to an x-ray. I'm going to focus more on the light forces because these are 5 pillars, and I'm not going to talk about bracket placement. I talked about that with you back in Moscow in November, but I want to talk to you about light forces, transverse arch development, and sound Damon mechanics. I think that those are key. I've shared this with you before. I'm going to share it again because I feel so passionate about it. I feel like that with the Damon system, with passive self-ligation, light forces rule. And light forces mean that we want to stay light through all phases of treatment. And that's not just in the beginning. When we put the bigger wires in, we want to make sure that we're staying light. What it basically comes down to is the periodontal ligament. It's the periodontal ligament that controls all tooth movement. If we abuse that periodontal ligament, we start to foul up the Damon system and we cause problems with the Damon system. So if you'll remember this, and if you start having trouble with the Damon system or having trouble finishing, remember we have to protect that periodontal ligament. And this is a slide that we've shown, I've seen a million times, but it's so important to remember that little micro lattice structure of the blood vessels right there at the periodontal membrane or the periodontal ligament and the tooth. And we don't want to abuse this. So force management is one of the keys to the Damon system. And so that takes me to number 2. Number 2 really has to do with expressing the anterior crowding into posterior arch width. Now, if you don't do this, you're going to cause the teeth to just dump forward. And I want you to understand that this right here is so key in all of our finishing. So I want to show you a case that I've just finished, and it expresses this point of taking the anterior crowding and developing it into posterior arch width. In fact, I've not put this case together. Dr. Nichols and I just finished this case. There are some really cool things. This is a gummy smile treatment case. This was Tad's, and we'll put this together. When I come to St. Petersburg, I'll show you in depth how we treated this case. But this is a beautiful case, and what's cool about this case is that this case shows the power of the transverse. And I'm going to make a statement here that's so important. I will tell you that the most important key of the Damon system, or the most important pillar of the Damon system, is the transverse. It will solve many of your orthodontic problems. If you get stuck in finishing, if you're having trouble and you're not seeing your case getting down the path where you want to be, go back and look at the transverse. That is one of the huge keys to the Damon system. So I want to just show you this. Now, what happens here, we've talked about treatment planning to the face. Look at what happens. Now you can see that she's got a little lip strain. You can see, if you pan in close to that, Brad, you can see she's having trouble getting her lips over her teeth and having trouble closing. And many of these patients that are like this, many of the doctors that I talk to start to think, oh, if they're struggling to close their lips over their teeth, they must be a little bimax protrusive or dental protrusive, so we may have to extract teeth. But what I want you to understand is the power of the arch width and the transverse then allows you to have this beautiful, look at her lips, look at how she closes. She is no longer straining because we've created a wide, broad arch form, and we've allowed the teeth to move into the correct positions, and because of that, we have this beautiful lips. Look at her profile for a second here. Now, you can see she's pursed here. Do you see how she's just a little bit full? I wouldn't say this is a bimax protrusion case, but I would say that she's straining her lips because she's a little full, a little crowded in the anterior. Look what happens after we treat. We widen and broaden. She has this beautiful lip curl and beautiful relationship. She's no longer straining. So when you look at this case, and again, I'm not going to go into all the details of this case, but you're taking the anterior crowding here that you see and you're developing it into a beautiful arch width. Notice a couple of things on this case, and I think this is such a powerful case to show you. Do you see how all of the posterior teeth are upright? We're not dumped in, we're upright. Notice the lowers. We have a slight tilt to the facial surface. This is called a good functional occlusion. But this is what we're trying to accomplish, these beautiful wide smiles, and it's the transverse that really gets us to these finishes. Look at this. Beautiful width and arch form. And again, focusing on that beautiful arch width gives us these beautiful cases. Again, when we're finished, we put a permanent wire on here. This is a braided arch form, or arch wire from Reliance, and you can see that we've bonded that to every tooth. Look at the lower. Now she was a little flared in the lower anteriors, not quite as much there, but this really shows really how powerful this is. anterior crowding now developed into posterior arch width. Even the lowers, look how upright the lowers are after we've finished, because we've spent the time to understand how important the transverse is in cases like this. So taking the anterior crowding, developing it into posterior arch width. The last little key that I'll focus on was really the Damon mechanics, and I've shared this with you before, but I'm going to share it again because I feel it's so important. Using those same sound Damon mechanics as found in the workbook. Now, one thing that I'm finding as I've traveled around the world, I've been to 31 different countries and lectured, many countries twice, like in Moscow. And I'm realizing that many people are embracing the Damon system or passive self-ligation, but they're still using old techniques. They're still using power chain over the top of the brackets. They're still using wires that aren't Damon wires. And I want to just tell you that if you're going to use the Damon system, you should use it as it was prescribed. In fact, I was at the Damon Forum in the United States this last February, and one of the speakers mentioned on stage, and I was taken back just a little bit. He mentioned on stage that he doesn't use all the Damon principles because things have changed and he doesn't need to do that. And I want to caution you, and I just listened, I didn't say anything to him, but I want to caution you. If you think that you're going to buy the Damon bracket or use passive self-ligation but not use those principles, then I want you to know that you're not going to see those beautiful end results. And if you're wanting to get those beautiful results like I'm showing you here, you got to use the system the way it was intended to be. And one of my life goals, if you would, or my mission in my practice and as I teach worldwide is to make sure that I keep the system pure. And
we have a question, actually.
Good. Well, we got a question. Let's answer that.
So Dr. Stechmo says, Stu, did you use anterior rainbow elastics at night to prevent anterior flaring? I think is probably what he was meaning.
On this last case, let's go back to that for 1 second. The mechanics in this case, now remember I said that this case was a gummy smile case, okay? So in a gummy smile case, we're going to use low torque brackets in the anterior. We're going to control so that the teeth don't flare. So in this case, I don't have all the mechanics there, but if we started to flare, I would just use a little power chain sling under the brackets to help control the torque. So if that's what you mean, then yes. The elastics in this, we did do vertical elastics as you intrude the case. We use vertical elastics to let the lower arch auto-rotate and come up and forward. But in this case, that was what we used.
Awesome.
So thank you. Thanks for that question.
Mm-hmm.
So when we get in looking at this, and of course, you know, you can see the beautiful contours. I just want to make sure that we are understanding how important it is to use the Damon mechanics. Now, by following these simple principles, you're going to have better finishes than you've ever had before. You're going to have greater patient comfort and more fun than you've ever had before. So I'm going to just talk for just a second. You know, when I was with many of you in Russia at the end of November, one of my focuses was really about 5 keys to creating those beautiful, I call them frostsmiles. You can call them Posy smiles or Zarnoff or anybody. But for me, there are 5 little developmental keys, and I spent a lot of time talking about this. It's really not my purpose to go into all these keys again, and because I know we have a short amount of time here. But I want to share with you a couple of things, and I'm going to show you a new case here in just a second. But part of the pillars we use in crafting these beautiful finishes. So we talked about the face being one of the pillars. We're treatment planning to the face. So what that means to me is that all the emphasis should be on the upper lip and the mid-face, okay? Now, we're also treatment planning our cases around the upper incisor, making sure the midlines are on the face and that we have the correct amount of incisor display with an authentic smile. Number 3, we're talking about buccal arch width. We just spent quite a bit of time talking to you about how important posterior arch width is, and then smile arc. We've been teaching this for many years, and then the correct hard and soft tissue contouring. Now, remember, if you just remember this case I just showed you, those hard tissue and soft tissue contours, that looks so beautiful because we spent the time to do the contouring of the enamel, do the contouring of the tissues, and that's why that looks so beautiful. So when we get into this case here in a few minutes, we're going to use all of those principles to treatment plan this case, all right? So with that, let's get started. This is a new case that we just finished in our practice, and this is a Q2 case. We're going to talk about what happened in this case, and we'll talk about Vanessa's treatment. Now, with Vanessa, she's 14 years old, and if we look at her facial features, one thing that I notice on this case is that she's a little bit mid-face deficient right in this region right here. I like her vermilion display. She has good proportion. The lower lip is bigger than the upper lip. I like that proportion. She's a little bit asymmetric with the lower jaw, but most of us are. So when we look at her facial features, I think she's well balanced, and I start thinking to myself, okay, what can I do to enhance the mid-face? And I'm talking about this region right here. Many of you probably weren't around 20 years ago when we started using the Damon system, and when Dr. Damon, Dr. Pitts, many of the icons in our industry, they were talking about how important this region right here is, especially for females and facial aging. So on Vanessa, we're going to create a really beautiful mid-face so that she ages very gracefully. If we look at her upper lip, this looks really nice. I like her vermilion display, but we're going to increase a little bit more arch or a little bit more facial support right here. She's well balanced in her upper and lower lip. And so this is important to say. We say to ourselves, okay, if she looks good with her facial features, then when I go to look at her intraorally, I want to design my treatment that either enhances her face or preserves it right where she's at. So if we look at her smile, now this is an authentic smile. And we spent a lot of time when I was in Moscow talking about what is an authentic smile. And I spent time, trying to help us all understand how do we get that authentic smile. Now, when we look at this, again, the second key to treating these cases is to make sure we show 100% of her incisors, and that looks beautiful. The second part of the upper incisor is that we want to make sure it's on the midline. Now, this is the midline right here. You can see that her midline is a little bit off to the left of her facial midline, and I'm talking the lip, not the nose. And if we're looking closely, I just got done talking to you about how important the transverse is. Look at the dark corridors here, and look at the dark corridors here. What I'm going to do in this case is spend quite a bit of time working on the transverse and increasing those corridors so that we can have a beautiful end result here, okay? So now we can look at our intraoral here. Here's our intraoral picture. Now you can notice that the upper midline is off. I think the lower midline is actually on the midline of her face. And if we look closer at this case, you can see this just looks like a severe amount of crowding in the anterior. So if we go back and look, good class 1 on the molars. She has a little bit of a tongue problem going right here. And the way I look at this is whenever you see the occlusion coming together beautifully here, except for one spot, and there's a little opening, that usually tells me there's a tongue problem. And if there's a tongue problem, that would explain why there's so much anterior crowding. Let me just say this. Many times when I see patients that have proper tongue position, tongue balance, muscles of the face balanced, then I don't see severe crowding like this, severe anterior crowding. So for some reason along the way, Vanessa has developed a tongue issue, and that's why we have narrow arches. So if we go back and look at the other side here, see the tongue pushing right there, and we notice a little bit of bubbles that are happening in the saliva. Can you see that? That gives me a clue that she has a tongue problem, and so we're going to address that with treatment, okay? there, and we'll talk more about that here in a few minutes. So here's the amount of crowding, severe amount of crowding in the anterior. The way that I'm thinking in my mind is, I'm thinking, okay, I love her facial features. I don't want to detract from those facial features. So I'm automatically thinking, can I or can I not do this case without extracting teeth? Because I want to treat her without extracting teeth, because I don't want to have negative impact on the facial profile as she ages. That's what I'm thinking as we're looking at this case. Now, notice the posterior arches. See how this is dumped in? The canine is sitting straight up and down here, and there's a reason that this side is dumped and this side isn't. She's pushing more with her tongue on this side than she is on the other side. So for me, what I'm going to work on and focus on is uprighting these posterior segments so that we get a wide, broader arch. And do you mind? Thank you. We're still seeing a couple people here, but what I'm going to focus on is how do I create the arch width to overcome the amount of crowding. So with that, you can look at the lower arch. See the lower arch here? The bicuspids are dumped in. With the bicuspids dumped in like that, what we want to do is upright. When we upright and widen, we get space. So that's how we're going to look at this. If we look at the arches from this way, notice that the upper arch, the anteriors are dumped in slightly. Notice we have a flared incisor here, these are dumped, and the posteriors are dumped. Now, what I start thinking is, what happens when I widen and broaden an arch like this? When we widen and broaden an arch, we get space. So I need a little bit of space. The other thing is remember what I said, I want to enhance, I'm going to go back very quickly here. I want to enhance this part of her face. And if that's the case, and I wouldn't mind a little bit more of a full upper lip. So if that's the case, then I want these incisors to come forward. So I would start thinking, if I want those to come forward, I'm going to engage every tooth here with the initial wire and allow these to come forward, which is going to give me more upper lip support. Now, on the lower, when we look at the lower down here, I'm thinking a little bit differently. I don't want all of these teeth to go forward. I do want posterior arch width, because as we get posterior arch width, we're going to make more room for the lower crowding. But I'm not going to think about engaging every single tooth on this case, because if I did, the lowers are going to come forward and flare forward, and I'm going to have a tough time overcoming that. So you'll see how I set this case up here in a few minutes, but what we're doing is we're just thinking about how we're going to treatment plan this case and how we're going to create this beautiful smile so that we can have a beautiful smile without flared teeth and get this to where we have this beautiful outcome. So if we look at our CT scan, we can see in the CT scan that she does have her third molars. At some point those are going to come out when I see about half the root formed, but at this time it's looking pretty good. We don't need to have those out to get started, and we're just noticing those types of things. Now, I gave you that I have a TMJ background. We're just verifying that things look okay. Her condyle on her right side looks a little funny. It's not centered in the fossa, but I believe that could be from the occlusion. So if we look, we have a little bit more of a posterior centered condyle. So it's not centered in the fossa, it's slightly posterior. If we look at the other side, on the left side, it looks to be in pretty good position. But I believe that as we unlock the occlusion on the right side, that will come forward into a good position, okay? When I look at the health of the condyle, that looks pretty normal to me. Nothing that's of concern. She reports no clicking and popping and no pain. So when we look at, I love this picture because we can see, here's the midline, right? If we drop the plumb line straight down, you can see the midline is slightly off. My goal is to fix that so we have the midline on the face. We're going to create a beautiful smile here with the Damon Q2 bracket, and we're going to show you how we do this. Now, these are the torques that I picked. I'll show you how this works out for me. In my lectures, I talk all the time about when we go to pick variable torque. This is another key element of the Damon system, is being able to pick and choose variable torques for your cases. So in this case, I'm going to look at it and I'm going to choose a different torque according to what I see. So if you look back, and I've shared in my lectures before, when I look at this, I would say to myself, okay, pick the easiest one in this whole arch. And if you were thinking there, I want you to think in your mind, which is the easiest tooth to pick torque for? For me, it's usually the cuspids. Like, you see how this cuspid is towed in? It's dumped in, so I'm picking a high torque bracket for that one. Look at this one. This one's towed in, so I'm picking a high torque. Now, if you look at this one, because of that tongue thrust, that canine looks like it's almost been pushed out of the arch. So I want that to dump back in or come back in during treatment.
They may not be able to see your cursor, so
Okay.
you may want to name the teeth. That's cool.
Maybe if I point to it.
Yep.
Great. Thanks for sharing that, if whoever shared that. So if we look at the canine here, this one's dumped in, so I used high torque. This one's dumped in, so it's high torque. Now, why would I choose standard torque on these lowers if there's so much crowding? Well, we have to go back to our mechanics. Remember what I said. I don't want these lower anteriors to come forward. So we're going to set this case up where we use springs for the blocked out teeth. And when you use springs and skip teeth, that helps us focus on widening and broadening instead of just dumping teeth forward. Okay? Remember on the top, I want those teeth to come forward. If we look at it from this other point here, this one's already flared forward right here. So if that one's already flared forward, we want a low torque. My thought was that this one, if I go back for 1 second, and the way I look at torque is this: if you picture a wire coming through all the bracket slots like this, and the initial wire is going to come down through this one's going to want to come out and flare. So I'm going to pick a low torque there. These are in a pretty good position. If they just come forward slightly, they'll be in a good position. This one's already flared out, so it gets a low torque. So the two laterals get low torque. It wouldn't have been wrong, as you'll see here in a few minutes, to have chosen low torque 2-2, and you'll see why that is as we show the case. On the lower, remember what I said, this one's already sticking out. Because that one's already sticking out, that's going to get a low torque. But look at this one's dumped in. Okay, we're going to bypass teeth, you'll see in a few minutes, with springs to encourage these to widen and that to widen. Okay.
Someone said, shouldn't it be low or negative torque for the lowers?
Yes, and so the question is shouldn't it be low torque? If you're going to use low torque here, you've got to be very careful, because sometimes low torque will kick roots out, and if there's a thin biotype on the lower anterior, low torque could cause some stripping of tissues. Now, remember a couple of things here. For me, I don't finish in anything greater than a 1625 stainless steel on the lower, okay? So if that's the case, that's really not going to express much of the torque. The way that I'm going to get around not using low torque down here is by bypassing teeth and not letting those lower incisors flare forward, okay? Now, if I had a mild to moderate amount of crowding and I wasn't going to bypass teeth, I could get away with putting low torque and engaging every tooth here with an 013 copper nitrile. But in a case like this, because I'm using coil springs, standard torque's going to be fine. You'll see how this plays out. Great question. Okay, so let's jump into this. We're putting the braces on. We're 6 weeks into treatment now. Do you see what I have here? These are the coil springs that I'm talking about. And notice that this is the beginning. Do you see how there's already a little bit of tissue loss and look right here. There's already a little bit of thin, look on this side here, Brad. There's a little bit of thin tissue down here. This is why I'm concerned about putting a low torque bracket on there. This is as well, because I don't want this tissue to recede. And so we're gonna use coil springs for these blocked out teeth. As you can see, these are the coil springs, okay? This is an 014 copper nitrile. Now this is 6 weeks. We've just put the new wires in, and we noticed that we're stopping the 014 to the 5, but the 016 comes back to the 6. Now we're gonna put 018 copper nitiles in on the top at this time, which will go all the way to the back. Now this photo was taken before the adjustment, okay? Look at this side, and you can see the coil springs. This will show it a little bit better. Notice we've got a good stop on either side on the top here, and we've engaged all these teeth. Notice on this other side that we've let the lateral come forward. The lateral is starting to come forward, and notice the lower. Now, I want to point something out here. This is not the type of mechanics that we teach, and I have to catch myself and catch my assistants all the time, because what we teach is to activate this a half a bracket of coil from the cuspid, and if the coil was stretched out, it would be to about half of the lateral. But we want to tie this to the lateral so that as we make space, the lateral slowly comes forward. Notice over here, we bypass the cuspid. It wouldn't have been wrong to go ahead and bypass a little bit more teeth if we wanted to, or use bigger coil springs, but this is what we did in this case, okay? Now, at 10 weeks into treatment here, what we've done is we've placed the 018 copper niti all the way back to the 7. If the 7s were in, they'd go all the way back to the 7s. And we've placed an 013 copper niti on the lower. You'll see this here, okay? Now we've made room, enough room where we're gonna engage with a very light copper niti, 013 copper niti. Notice that it didn't go all the way to the back. 013, if it goes back through the 6, is just gonna come out. The upper 018 goes all the way back. And if you notice this, you're gonna see now the 7s are just coming in, so we haven't put brackets on those yet. She's gonna get brackets on those. This is after 10 weeks. We've now put an 013 copper niti in here, and we've done enough with making space, and you're gonna see how this plays out as we go along, okay? So at 4 months into treatment, what we've done is we are still in 018 copper niti, and now because the lower has started to straighten out, you can see how beautiful this is playing out. Notice the bracket positioning. Good bracket positioning is going to maintain what you had when you started. Look at this. We don't have time today to talk a lot about bracket positioning. We talked about it in Moscow. But good bracket placement is going to allow you to have a beautiful occlusion, okay? Now, we've just put 018 copper niti here. As soon as the 7s are all the way in, they're going to get brackets. You'll see this in a few minutes. 018 copper niti, let the 018 copper niti work on the top. We're 4 months in and we're still in round wire. That's okay. We're not in a rush here, okay?
Someone asked, what are your thoughts on the efficiencies of just adding a second 014 copper niti as tandem, then jumping right to rectangular 18, 16, 25?
Yeah, so about 10, 12 years ago, we were experimenting with this. We would take an 014 copper niti, we'd leave it in for 8 to 10 weeks, and we put another 014 in there. I found that when you did that, it didn't have the efficiency that I saw with an 018 copper niti, even though 014 and 014 is 018. I didn't find that was efficient, and I found that just going to an 018 all the way back was just as efficient. Now there's many times where I will go from 018 or 014 copper niti straight into a 1425, but I've kind of gotten away from using 2 wires, and part of it is also the expense of adding more wires. So I don't use that anymore. I didn't see a benefit.
So a lot of people are asking why you didn't engage the lower 6s to begin with. Do you want to reiterate what you said earlier?
Sure. So let's go back. If you take an 013 copper niti, it's a very light wire. You see the span from the 5 to the 6? If you took this wire back through the 6, and you just have to trust me on this one, that wire is going to come out just from the mastication forces and chewing. This is going to come out and poke the patient, and they're going to be back in your practice for an emergency. So instead of doing that, just turn the wire. You can clip it distal here if you want, or just turn it. But if you leave a light 014 or 013 and put it through the 6, it's going to come out and hurt cause an emergency. When you go to 018 wire, 018 always goes back to the last tooth. But 014, we want to clip it. Now the upper is a different story. The upper can go back through the 6. It's not going to cause an emergency. Okay, good. Okay, so we'll get back to this case. Let's show you where we're at here. This is 6 months into treatment. Now, at 6 months, we're going to transition to 1425 copper night tie. 1425 on the upper, it's going to go all the way back. 1425 on the lower. Now notice, as you look here, now we've wire tied the anterior. We spin tie this underneath. That's to keep any space from opening up. If there's any rotation still left on the lower arch, we won't wire tie. And I'll show this to you. See the spin tie underneath? If you look at the lower, we still have a couple little rotations, little deflections in the wire, so we'll wait on that. But if all the rotations were out when we went to the 1425, then we would wire tie like we did on the upper. So notice this 7 down here is not all the way through. As soon as it comes through, I'm going to put a bracket on that and take the wire all the way back. And if you look at the upper, these are almost all the way through. So at the same time, we're going to bond the 7s. Okay, many doctors leave the 7s out of this. I want the 7s included. Okay, being that she was 14 years of age and ready to get started, I decided not to wait for the second molars to start this case, so I went ahead and put brackets on, and we'll bond the 7s when they come in. You'll see that in a few minutes here. Notice the arch shape here. Now this is what I was referring to. Now this is with round, we've just put, you can see we've just put, if you look really close here, Brad, do you see that wire? That blue mark means that's a brand new wire. That's the 1425 has just been placed. That means up 6 months of round wire, and I want you to look at the arch shape. How in the world does a round wire, 014 and 018, create that arch shape right there? Look at where we started. Look at where we are right now. This is one of the huge benefits of passive self-ligation. And this is I try to share with people around the world, that by using these light forces and not binding up the posterior segments, you've got tubes on every molar, that allows this slow uprighting of teeth. The tongue raises up and gives you this beautiful arch. We've got a question?
Yep, we have 2 questions. One is, would bite turbos have helped in helping correct the deep bite and facilitating expansion with the least posterior contacts? And the other doctor asked, did you not use light early elastics for this patient? So
good. So if you look at this case here, and I'm sorry that I didn't mention it, but we did put posterior bite turbos on, and I agree, putting posterior bite turbos will disarticulate, will help. And in this case, if we go back for just a second, notice in this case, she's class 1. So if she's class 1, there's no reason to wear some elastics. Now, I have heard of some doctors that will wear a class 3 elastic in a case like this to keep the canine in a more of a force to the posterior so that the lowers don't flare forward. I don't think that it's necessary to start initial elastics in all of these cases. And it wouldn't have been wrong to start a class 3 elastic in a case like this, but because we're using coil springs, I didn't feel the need to do that.
someone asked about re-educating the tongue in this case. Did you do anything with that?
Yeah, so many times what we'll do is if it's a slight tongue thrust like you saw in the beginning, let's look back here. You see how this is just a slight tongue thrust here? We'll tell the patients, look, we want you to practice putting the tongue where it should go. It should raise to the roof of the mouth, and we will talk to them about re-educating of the tongue. If they have troubles, what I see many times, if they've got a slight tongue thrust in the beginning, as we go along, it can develop into a forward tongue thrust and cause the case to go out of control. That's when we'll put tongue reminders behind the teeth. In this case, we didn't need to do that.
And then another person asked about anterior bite turbos. Why posterior versus anterior?
Yeah, so in many of these cases, the way that I look at these cases is I look at the facial features. I'm going to go back really quick here. I look at the facial features, and to me, if you put an anterior bite turbo on, you're going to drop this jaw down and back. You're going to make her more class 2. For me, if the uppers are going to come forward, then I want to facilitate more of the lower to come forward a little bit, like the idea of jaws forward. So a posterior bite turbo made more sense to me. If she was over closed, more pinched in her face, or if she was more of a flat occlusal plane or a flat mandibular plane angle, then I would put an anterior bite turbo in this case. But in this case, a simple posterior bite turbo would facilitate more of what I was looking for. Okay?
Awesome.
Good. I'll scoot back through here.
Cool.
Okay, let's look at 15 months of treatment now. At 15 months of treatment, we're going to do our panel repo. We're going to we've already done our panel repo. And one thing I want to just point out, so when we've done our panel repo, we've repositioned in brackets, now we're getting into the finishing stages. And finishing stages to me mean about the next 6 months. Once we put the stainless steel wires in, that's the finishing. That's when we really work on torque, posterior arch width, and how the smile and the arch shape looks. So if you look at her, if you look at Vanessa, this is where we say what is left to finish this case. Let's look. Midline. Midline looks beautiful. Okay? Smile arc. Smile arc's looking really pretty. If we look at buccal arch width, you see how the smile, the teeth don't fill the corridors here? So what we're going to focus on over the next 6 months in finishing with our stainless steel wire is widening and broadening the upper arch and uprighting the posterior segment. So that's what we're going to focus on. Now we're in a 1925 stainless steel on the top. We're lagging a little bit behind on the lower because we picked up the lower 7s, and we'll get there with the lower arch, and the lower arch will be 1625. But notice a couple of things. On the 1925 stainless steel, we put a post here. That post on the wire is going to be used for any elastics that we need, and is going to allow us to hook rubber bands to those posts, okay? Now, eventually we'll get posts on the lower when we're in stainless steel as well. Notice the occlusion looks really pretty on the right side. If we look at the left, she's class 2. This is about the time we start to take down the bite turbos so we can get the occlusion to come on. We'll leave the bite turbos on until the occlusion's all the way fixed, but we want to make sure that this turbo is not keeping the occlusion from coming together. If you look at the arch shape, this is beautiful. Notice the lower. Now, it looks like she lost a bracket right here. We're going to put that back on. We've got a half bracket on this side, and you'll see that we struggle a little bit with that. Here's a little bit of an up-close picture. Notice the slight toe-in of the posterior segment. That's what we're working on, broadening the wire to upright those posterior teeth. Okay, here she is at 18 months of treatment time. Now notice we're in finishing wires here. 1925 stainless steel on the top, 1625 stainless steel on the bottom. Some of you might say, what is this rubber band right here? What this rubber band is, this is called a K-tie. That is a K-tie, and that is just to keep the space in the posterior consolidated so it doesn't open back up. Okay? Notice it's on the lower as well. It's just keeping the space in the posterior consolidated. All right?
Dr. Angelucci asked, do you do any IPR, and with arch expansion, how do you determine the biological limits?
This is a really great comment. Yes, I do IPR quite a bit, especially because I treat 50% adults. So I do a lot of IPR. And when we talk about what are the biologic limits of uprighting and widening arches, I think this is such a key point. And I'm going to show it to you here in a few minutes. But what I'm looking for, let me just go back to this. The limits of arch width really is the lower arch. We treatment plan to the upper arch, but the limit of how far we can widen and broaden is the lower arch. And what I mean by that is we still have to have a functional occlusion. You see, if the upper arch gets too broad and the lower arch is already upright, we can't over upright the lower arch. We're not getting, and I think this is a really important key. Let's pretend this is a lower arch. We should have a natural inclination to the lower arch. If the upper arch is over widened and the lower arch then is upright, and we have the proper inclination, if you over upright, that opens the bite. So what limits us is the uprightness of the lower bicuspids and cuspids. Once they've uprighted to the proper position, then the upper has to match that for a functional occlusion. I'm going to show you that at the end of treatment, so if you hang on, I'll show you that. It's a really great question.
One more question about your technique for broadening the arch wires, as well as why not TMA versus stainless steel?
So these are great. I'm going to make available, now my son Brad, he and I run the FrostSmile Academy. And the FrostSmile Academy is a online learning education tool that doctors can sign up for. There is a fee to be a part of that. There are courses that we have that are in the FrostSmile Academy. If you want to know more about this, we have videos that show how we widen wires, how we coordinate wires, how we do all of this. So if you want to be a part of it, go to www.frostsmileacademy.com. And you can see there's courses in there that you can take that show how we widen arches and how we do this. There's a really, I have a course in there that talks about why we finish with stainless steel versus TMA. There's a course in there on the 13 keys of finishing. There's a course in there on how to do gummy smile. There's so many courses that you can obviously there's a fee to have that course, but it's an online education portal. Unfortunately for this small webinar, I don't have time to show you. I wish I did. We also have in-office courses that some of you have attended as well. So as far as stainless steel versus TMA, TMA is a very good wire if you're bending torque, but it's not a very good wire to create arch shape and arch width. And I liken it unto this. If you're finishing in TMA, it's because it's easier for you to put that wire in and make adjustments. And don't be fooled. The reason I use stainless steel is because Dwight Damon taught back in 1997. When he showed me those beautiful cases, he taught that his finishing wire was stainless steel 1925 upper, 1625 stainless steel in the lower. And I will tell you, if he was, in my time watching him, he was the best orthodontist in the world. Him and Dr. Pitts were just the best orthodontists. So I wanted to do exactly what they were doing, and that's what we were finishing in. I asked Dwight Damon a couple of years ago, I said, did you ever finish in TMA? And he said, no. I always finished in stainless steel. So in my mind, I'm thinking, if I want to be like them, if I want to get beautiful cases like them, then I'm going to finish in stainless steel. So thank you for that question.
Cool.
So let's wrap this up so we have any last questions. You can see that we've got beautiful occlusion. She's almost corrected her class 2. On this case, we're doing a class 2 with mousse, 5/16 6 ounce, lower 6 to upper post. On the right side, we were just doing a triangle, which would just be from the upper post to the lower. And there should be a hook here for our triangle, but that's all we were doing on that side. Okay, so look at the alignment, beautiful alignment. The bite turbos are still on. They're about to become off. Once the occlusion comes together, we take the bite turbos off, and you can see how beautiful. Now look how beautiful the alignment is here. This is the alignment with the Q2 bracket. I love the Q2. It's just beautiful. Notice in 20 months of treatment now, we put our finishing wires, I think our finishing wires were in at 16 months. So that's 4 months in our finishing wires. Notice we're almost upright in the posterior. Notice how we're filling the corridors. That looks really beautiful. If we go back for just a second, this should say 20 months, I think. Remember, I just put this together for you guys. This case is I spent so much time trying to put this. In fact, Brad helped me. And so when you put a case together, I kid you not, it takes like 18 hours to put a case together. So sometimes we get little errors like this. So I think that this is saying, if we were 20 months of treatment here, I think this should say.
Oh, that's my fault.
That's okay.
Sorry about that.
No problem. We're going to just say this here. So all the rest of these are 20 months. So we're just about finished. We're just working on our midline here. If you look, our midline's almost on. She's almost class 1. This is just encouraging her, keeping her excited to wear the elastics. You can see that everything's beautiful. We're just about finished. This is 22 months of treatment. This is her finish. Now I want you to look how beautiful that is, okay? Look at the posterior segment. It's upright. Notice it fills the corners of the smile. Notice her beautiful smile arc. If you look at her facial features, she's no longer straining. Look at the lips. Beautiful, full lips. Beautiful smile. I love this picture right here. I mean, this is what we're talking about. Creating a beautiful transitions from the front to the back. This beautiful upright posterior arch segment. We'll show some more here in just a second. Notice her mid-face. See how the mid-face has more support? This was one of our goals, is to get more support in the mid-face. Look at that right there. It's beautiful. Okay. Now, if we look at 22 months of treatment, the midlines are centered. The contours are great. Now, this is before we did, she's actually next week coming into my practice for a gingivectomy. We're going to just contour that lateral and maybe this one just a little bit so that this can be a gorgeous case. And see how this finish, that lateral needs a little bit of contouring on the gum tissue. So we're gonna set her up for a gingivectomy. Notice how beautiful a class 1 is. She's class 1, beautiful torque control, good retention. This is what I wanted to show you. And if we focus on this now, again, notice on the lower here, this goes back to functional occlusion. If you look at the posterior, do you see how they're upright? You cannot upright these anymore. If you upright these anymore, they're gonna go into make the occlusion not set well. So this is the extent of uprighting on the lower arch that you can do. So we couldn't upright or we couldn't widen the upper arch any more than that. So that's what limits us for how far we can widen the upper arch. If I go back, see how beautiful this is. Notice that beautiful occlusion, the functional occlusion. These are all upright. This is gonna be very beautiful as the patient ages. Okay, so here's our panel. We look at everything. This is what's happened in the case. You can see that she's come forward with her upper incisors. That looks beautiful. We did get a little bit coming forward of the lower incisor here. That's okay. I have no problem with that. All right. Notice what's happened here. Beautiful uprighting. And this is what it's all about. It's about creating these beautiful arch widths and beautiful smiles. We have just a few minutes left. I'd love to answer any final last questions here. I want to tell you it's been really fun to spend my Friday morning, your Friday evening with you, and to share just some pearls. I wanted to give you some pearls and some things to think about in case you're not working at this time, or just something to inspire you to be great. So let's answer any last questions here.
Let's see here. Do you charge extra for a gingivectomy?
We do not charge extra for gingivectomy. What we do is we charge a very healthy fee, and we include those things at the end because that's part of our frost smile is a gingivectomy at the end.
Someone asked how the TMJ ended up in this case.
Yeah, TMJ ended up great. Look how nice. See how the condyle came forward? Look at that. It looks beautiful. By fixing the occlusion, that unlocked the condyles to come forward. So thank you for asking.
Let's see. Did you use striping or stripping and chain sling in this case? I guess.
Yes. Yep, we did. And I didn't get a chance to show you all the details. So we would do some IPR and the sling to control torques of the anteriors.
Cool. How long do you leave a lower bonded lingual retainer?
Lower bonded retainers stay on for life. The upper is going to come off after a year, and we leave them off.
Someone asked, what do you mean by consolidating from 3 to 6 on premolars?
So let's say you have a little bit of space in the posterior during treatment. Let's say we use, and I don't use a lot of power chain, but if we did use power chain for one visit, maybe 4 weeks, and all the space in the posterior is closed, we want to keep that space closed. So we'll use that tie back from the hook mesial to the 3 to the molar to keep that space consolidated so it doesn't open back up.
Cool. You got 30 seconds before this Instagram live cuts you off, so do you want to close it out?
I'm just going to close it out with this. These are other beautiful cases that we've just finished. Gummy smiles. I can't wait to show these to you. I showed you that one. If there's anything else, reach out to me. If you're looking to have better finishes, keep going, Ormco. Thank you so much. It's been a pleasure, and goodbye. Remember to save that.
Yeah. And now.